Well, hi everyone. Welcome back to our webinar series of tobacco cessation. My name is Olivia. I am a health educator for Argus Community's CATCH program, which is community action to combat HIV and hepatitis C. My job entails doing HIV and hepatitis C testing, I should say, as well as doing group and confidential sessions on sexual health, mental health, and tobacco cessation. So today we are continuing on from our tobacco cessation series with tobacco use and COVID-19. So Sean, next slide, please. So this webinar itself is split into three groups. The first thing we'll talk about is COVID-19, what we know so far about the infection and everything that entails with it. Number two is tobacco use and COVID-19. What is the correlation between the two, and is there an actual risk or a severe risk of people who do use tobacco and COVID? And three, we're going to talk about prevention. So we'll discuss some of the ways that you can prevent the spread of COVID and, help reduce smoking cessation. So next slide, please, Sean. So again, this information is just to bring awareness to harmful effects caused by smoking. As we sometimes know that there are always going to be a negative effect from using tobacco, but for the most part, there's not that much, because COVID is so new, there isn't that much of a study on tobacco use relating to COVID. So this is what our webinar is going to be talking about. So next slide, please. Okay, so what is COVID? So COVID-19 is a coronavirus. So the COVID in it is an abbreviation. So the CO means corona, the VI meaning virus, and the D meaning disease. So it was it was discovered in 2019, which is why there's that 19 on the end of it. And that's why it is considered a novel virus, because it is so new to the human population. And that is why it's 19, because it was not even founded a year ago. Almost. So that's why it's considered a novel virus. It's so new. There's not that much research on it. And that's why it just took over the whole world in a very short time. So COVID-19 is caused by severe acute respiratory syndrome coronavirus 2, which is the type of coronavirus. It's like a strain of that specific coronavirus. The abbreviation is SARS-CoV-2, which is why a lot of people I've noticed, especially with the media and other news outlets, they would use that in place of using COVID-19, which isn't fairly accurate, because SARS-CoV-2 is just what COVID-19 is caused from. It's like the specific strain of the coronavirus. So if that makes a little more sense, they're not interchangeable. Now, also, it is a highly infectious disease, COVID-19. So when we say asymptomatic, when I say some people asymptomatic, it means you have no symptoms. So the reason why it spreads so quickly is because once people get exposed to it, you don't start to get symptoms right away. With a virus, any type of virus, it doesn't actually fully show up into your system until a few days later. And what they found with the COVID-19 is that it really doesn't show up into your body until 5 to 7 days later. And depending on your immune system and how your immune system will fight off viruses, you won't really get symptoms of it until a little bit later after you've been exposed. So if you are someone who has recently been exposed to COVID-19, you should not get tested until quarantine first and then get tested 5 to 7 days later, because that's when it'll probably show up positive in your system. That's why a lot of people recently have been getting a lot of false negatives, because immediately once people find out they're getting exposed to it, they're jumping real quick into getting tested. And in the first 4 days after you've been exposed to the virus, it doesn't show up as a positive test. It'll show up as a negative test. So that's where all the false negatives come from. That is why it also spreads so quickly, because if you're in the first 4 days, you got a negative test, you're like, oh, okay, I'm good. And then you go out and then start to develop symptoms of it and kind of spread it further. So the virus doesn't show up fully into your system until a few days later, like I mentioned. So that is why that quickly spread for as far as it did, because of not everyone gets the symptoms right away. And it's extremely infectious, as I said. So it's an airborne disease, which means that it is, it's usually spread through, coughing, sneezing, talking, spitting, or even singing. It's through the droplets and from the mouth and the nose. So anything that involves your mouth and the nose, that is how it is transmitted. And it can last into the air, which is why it's airborne. There's currently no vaccine or cure. So as of right now, we're currently in a race to get it. The vaccine, you always hear about all these countries and how their trials are doing. Recently, Johnson & Johnson put out a statement about their trials. Unfortunately, they are not having a very positive result. And this is what happens with vaccines. It's always a trial and error because they're trying to do the best they can that's going to benefit everyone who's going to get the vaccine. A lot of people are kind of worried why there isn't a vaccine out right now. And like we mentioned, there's a lot of trials and errors. It takes a very long time. If they rush into it, it's going to do more harm than good. So obviously the vaccine will help reduce transmission, but as of right now, there is no vaccine or cure. But if you do have COVID, you can recover from it. It is not like a long-lasting virus, but there are long-lasting effects to it. Okay, so next slide, please, Sean. Okay, so as of right now, there is about 7 million cases, a little bit over, I should say, 7 million cases in the United States. And there's also about over 200,000 deaths. And that is just the United States alone, whereas for worldwide, it is almost close to 38 million. And who recovered from it is about 26 million cases of people who have recovered from it. And unfortunately, over 1 million deaths of COVID-19. Next slide, please, Sean. There are over 460,000 cases in New York. Recently, we have been hitting kind of a rise in the cases back in New York again. So every day it's quickly changing from when we did do this. It was 460,000. That was barely a week ago that we recovered this, but it's actually unfortunately a little higher than that. It's about 480,000. But the deaths are pretty much the same. We haven't had that many deaths. It's just more cases now. So it is still at 33,000 deaths. But there hasn't really been a rise in deaths. It was more so cases. Next slide, please, Sean. So now the cases in New York, the cases in the United States. I'm going to talk about, the symptoms of the disease. So many people don't always have all the symptoms of this. You're going to get every so often a different symptom. You might get coughing with a runny nose, but you might not lose, shortness of breath or any type of body aches. But regardless of that, you should, if you do get one of these symptoms, you should always, call a doctor, try and get tested, like I mentioned before, and quarantine yourself. So the fever or chills, cough, shortness of breath, difficult breathing, fatigue, muscles or body aches, headaches, new loss of taste or smell, sore throat, congestion or a runny nose, nausea or vomiting, or diarrhea. These are some of the symptoms that you can get from COVID-19. This is also to mention some of these symptoms that I'm talking about. You could also have very similar symptoms to other viruses, such as HIV, also the flu. These are some very small viruses that do have the same symptoms. So you could think you have, a cough or a runny nose thinking it's going to be COVID, but then you could come back and find out that you were negative and it turns out you had the flu or, the early case of a human immunodeficiency virus, HIV. So that is something to consider as well. A lot of people did not know that. That's why the spread of it also continued on, because people just think, oh, I have a runny nose. It is fall. It is flu season. I don't have COVID. So it is more to be aware of your symptoms. I know a lot of people like, oh, I have a headache. No big deal. Or, I have some type of fatigue in my back. They're going to go on with their life. Especially now, I think it's more time to be in tune with our bodies. And if you do have if you do have a headache, or, if you do have a body ache or fever of some sort, this is definitely something to get tested for COVID in this case. I did hear also for flu shots as well. It is flu season. The flu shot does help with supposedly reduction in COVID transmission. So this is also something to look into as I'm talking about the flu. So make sure you get your flu shot. Next slide, please. So people of any age with certain underlying medical conditions have an increased risk for severe illnesses from COVID-19. And what do I mean by an increased risk? So it means that you're more likely to have a severe case based on your conditions you have as an individual. So you always hear about some people who have fairly a mild case of COVID, and then people who are being hospitalized and unfortunately lead to death. The reason why certain people have different cases is all based on your immune system, how your immune system can easily fight something off. So there's a lot of underlying factors that can affect your immune system. So one is underlying medical conditions. Older adults or old age. As you get older, your immune system weakens. And smoking, which we are here for today. Smoking does have an effect on your case of COVID if you do contract it. Next slide, please. So these are some of the underlying conditions that I recently just talked about. So underlying conditions, that is cancer, chronic kidney disease, COPD, chronic obstructive pulmonary disease, immunocompromised state, like I mentioned before, a weakened immune system that could come from a solid organ transplant, or any immunocompromised viruses such as, like I mentioned before, HIV and AIDS. Obesity, that also is an underlying medical condition. Serious heart conditions, any type of heart failure, coronary artery disease, or cardiomyopathies, sickle cell disease, type 2 diabetes. Next slide, please. Another one, asthma, any type of moderate to severe asthma. So, cerebrovascular disease, which affects the blood vessels and blood supply to the brain. Cystic fibrosis, hypertension, or any type of high blood pressure. And again, like I mentioned, immunocompromised states. Neurological conditions, such as dementia, liver disease, pregnancy, pulmonary fibrosis, which is damaging scarred lung tissues, smoking, thalassemia, and type 1 diabetes. Next slide. And like I mentioned before, old age definitely does have a factor in your severe case. This chart just shows that, if someone between 75 and 84, you're 8 times more likely to be hospitalized. And, and you have a 20% times higher of having a death than, someone who is 0 to 4 years old, which is 9 times lower. And if you are 85 and plus, it is significantly higher. So you can see from this chart, it obviously gradually increases. And it also goes with you're more likely as the older you get, you do have underlying medical conditions, but that isn't always the case. You could still have an underlying medical condition between 18 and 29. It's just more common to have an underlying medical condition as you get older, and especially the weakened immune system that you have. Next slide, please. Again, another chart that says for hospitalization, obviously the younger you are, the less likely you are to be hospitalized and have a severe risk, but as the older you get, it fairly increases. Next slide, please. And again, another chart for the older adults at a higher risk. 8 out of 10 COVID-19 deaths reported in the United States have been in adults 65 years and older. So this is just more information for you to be aware of, especially if you're someone who is a young adult or, younger than the age bracket of 65 and plus, but you do live or, work with people 65 and older. This is definitely something to consider. Like I mentioned before, transmission of COVID-19 is it's easier done than we think. We're always talking. We always have talking, coughing, sneezing, all of those particles are in the air, and we always have some very shared space with older adults. So it's good to be mindful of how it actually does affect older adults if we're someone who works and lives with them, because even though we might not have a severe case, they do. Next slide, please. And this is also a chart that we didn't mention before, but with recent studies, COVID-19, they have seen a severe impact on race and ethnicity. So if you are someone who is of Latino descent or someone in the Black community, you are more likely to be hospitalized from COVID-19 than someone who is of non-Hispanic, white, or consider yourself white, or an Alaskan Native or Indigenous person. So this is something to also consider as well, that COVID definitely does have an effect on race and ethnicity, and a lot of it does relate to, as a Black American, you're more likely to have underlying medical conditions at a younger age than someone who is a white American. So that is also a very good chart to see. All right, smoking and COVID. So this is our second part of our webinar, where I'm going to go into smoking and COVID. So number one is COVID attacks the lungs. So I haven't fully talked about what COVID actually does to us. So with it, it causes long-lasting lung damage. So now that more information is coming out, there are a lot of people recovering and dealing with the lasting effects that COVID has brought onto the lungs. So some of those types of damage that COVID can do to the lungs. So one is pneumonia. So pneumonia is when the lungs become filled with fluid and inflamed, and now you have severe breathing problems. And the specific type of pneumonia that COVID causes is when the air sacs in the lungs fill with fluid, and then it limits their ability to take in oxygen and causes shortness of breath. So this, pneumonia associated with COVID can be very severe even after recovery, and this can result in months of breathing difficulties. Now you're hearing a lot more people who have recovered early on from March and April getting COVID. They're starting to get a lot more damaged lung function that they notice. They're not breathing as easy as they used to. They have tons of lung damage because of the fluids in their lungs, and it's still causing that long-lasting effect. Now, unfortunately, for some cases, pneumonia will progress, and more if the air sacs become filled with the fluid, it'll leak from tiny vessels in the lungs, and eventually the shortness of breath will set in and then lead to ARDS, which is acute respiratory distress syndrome, which is a form of lung failure. So this can result in lasting pulmonary scarring. So caused from COVID, you could have severe lasting pulmonary and lung scarring. And with another one that can definitely cause a lot more damage is sepsis. So with this infection, it can reach and spread through the bloodstream, causing tiny damage everywhere it goes. So this is what sepsis is. It's life-threatening. Major organs will stop working properly. And even if a patient survives, it will leave them with complete lasting damage to all their major organs. So that is something to also to look into, how the lung damage resulting from COVID. There are 3 factors that really can lead to this specific lung damage. Like we mentioned before about underlying medical conditions. Your underlying medical condition actually kind of determine what you're at risk for. So if you are someone with an underlying medical condition, such as President Trump, who recently had COVID, there was a big watch for him because he has a lot of underlying medical conditions, such as obesity. It would seem that the disease severity is kind of a concern. So if you're more likely to have an underlying medical condition, it will cause for your severe risk of severe case of COVID, which is why this could obviously happen to you. Some of the stuff that I just mentioned about pneumonia and sepsis, this can result from having already underlying medical conditions. Treatment received is also another factor. If you are not receiving proper treatment as early as you can, this can result into getting a severe case of COVID-19 and having long-lasting lung damage. And also health condition, like I mentioned before, and tobacco and smoking. It definitely has a very big cause in how severe your risk of COVID can be. Okay, so I'm going to talk about the tobacco health effects on just in general. Tobacco does have a long-lasting damage to our bodies if you are consistently using. It can lead to heart disease, cancer, strokes, lung diseases, diabetes, chronic obstructive pulmonary disease, and so many more. And it causes a lot of respiratory infections. And as I just mentioned, it's a whole big thing on lung function, COVID-19. So already having a respiratory infection, it will already increase your severity of your case. So putting that out there. In April this year, WHO actually discovered that smokers were more likely to develop severe diseases with COVID-19 compared to non-smokers. And because it's already impairs your lung function and weakens your immune system, it makes it harder for the body to fight off the disease. So smoking obviously leads to conditions that have patients at a higher risk for developing severe illness when affected by COVID, and then unfortunately can lead to death. Tobacco is a factor of non-communicable disease. A non-communicable disease means that it's not transmissible directly from one person to another, whereas COVID is. So if you are already someone who does smoke or, use any type of tobacco product, it's already a factor in that you can't necessarily transmit smoke. However, there is secondhand smoking, but usually you have worse effects if you are the person who is the one using the products. Next slide, please. Okay, next slide, please, as well. So I don't think the video works. So what smoking tobacco causes, like I mentioned before, cancer, heart disease, stroke, lung disease, diabetes, COPD, and it also increases your risk for tuberculosis. So that's also including eye diseases and problems with the immune system, including rheumatoid arthritis. One thing I briefly mentioned before is that your immune system is definitely affected when you use any type of tobacco product. It definitely weakens your immune system. And like I mentioned before, the severity of your case also comes from your immune system. So there are a lot of effects that smoking does to the body correlating with COVID. Next slide, please. So coronavirus in the heart. Any type of heart condition that you might have could increase your risk for severe illness, but here's a few of them: heart failure, coronary artery disease, cardiomyopathies, and pulmonary hypertension. Having any type of cardiovascular or cerebral vascular disease, any type of hypertension or stroke, it also may increase your risk of severe illness from COVID. So why does the heart and COVID actually correlate? A lot of people, like I mentioned before, with the lungs, because the coronavirus does do a lot of damage to your lungs. It does a lot to your heart. So the heart and lungs usually tend to work together in the body to maintain oxygenation. So when the lungs are affected by a respiratory illness, the heart may also be affected. And, the heart works really hard to pump blood into the body, which may be even more difficult for someone with a heart disease. So when the virus attacks the body by infecting the cells directly, the virus primarily attacks the lungs, but it could also cause your body to produce an overactive immune response, which can lead to increased inflammation throughout the whole entire body. So this is where myocarditis can impair the heart's ability to pump blood and send electrical signals. There's also severe forms of myocarditis that can lead to more serious problems, like any type of abnormal heart rhythm, any type of heart muscle disease, or heart failure. One of the studies that I was looking into is from the University of Frankfurt in Germany, and they said more than half of patients studied who did have COVID-19 were found to have ongoing cardiac inflammation. So they also noted that more than 2/3 of the patients who participated in the study had a mild illness and recovered at home from COVID-19. So a lot of them were not hospitalized, but they still had lasting heart failure problems. So it's important to know that the abnormalities seen in this specific study from the University of Frankfurt, it can happen with other viral infections, and it may just be temporary. So there's not enough research backing that it's long lasting, because like I said before, it really necessarily, people didn't start doing research until the beginning of this year, because it's such a new virus, a novel virus, as I previously said before. But also, one thing about any type of heart inflammation is that many of the cases, they don't show symptoms and they just immediately get better on their own. Like I mentioned with the virus, and not many people do know they have it, because it doesn't fully show up in your body until a few days later. Because it's in the heart, you don't necessarily see your heart, so you might not even know you have mild heart inflammation at all, and it could just go away until you do go to the doctor and do talk about it, and you show some signs that they would only see. So that is very important to know. Okay, so next slide, please, Sean. So we're going to talk about the commonly asked questions about smoking and COVID-19. So as a smoker, is my risk for contracting COVID-19 higher than a non-smoker? So coming from someone who just did this whole thing, yes. When we just explained before, I just explained before that when a smoker contracts it, their risk itself is already at an all-time high compared to someone who doesn't smoke. But there is evidence that the cigarette smoking in general makes individuals more likely just to contract it. So not only does it increase your viral lung and throat infection, it inhibits the responsiveness of the body for infections. It weakens your immune system. So that's also a big way of how you can get it. One way is the physical act of smoking. So like I mentioned, you're using it with your hands, putting the cigarette in between your hands and putting it to your lips. You're having finger to mouth contact, and you don't know where your hands have been. Not many people are washing their hands before they smoke. You're also touching a lot of things. You're touching the package of the pack of cigarettes. You're touching, the bag that you had it in, or your pocket that you had it in. You don't necessarily know where everything has been. So the actual act of smoking does increase your chance of contracting COVID-19. The next question is, am I more likely to get more severe symptoms than a non-smoker? So there is evidence to really back this claim. So yes, because of the health risk, smoking already has effect on the body. And one of the first findings of coronavirus, which was in China, smokers were 2.4 more likely to be admitted into an intensive care unit than people who were not smokers. That doesn't necessarily mean only smokers are being admitted to intensive care units. Like I mentioned before, there's a lot of underlying medical conditions in the world, and not all of them are strictly related to smoking, but a lot of them are. So it doesn't physically associate every type of medical condition you got from smoking, because not everyone smokes. But smoking is still associated with the negative progression of the mild to severe cases of COVID. But I also should mention that even if you do smoke and you do use any type of tobacco product, that doesn't necessarily mean you will get a severe case. Like we've seen from before, there are a lot of people who do have underlying medical conditions and end up, surviving, having mild cases. And again, there's a lot of factors that go into that as well. Like I mentioned before, treatment received, the time that you got exposed to it to when you actually got treatment. These are all factors that do relate to you having a severe case or a mild case. So that's also something to mention. Like, just because you smoke or use tobacco products does not mean you're automatically going to have a severe case. It always depends on your immune system. It depends on when you found out you were exposed to it and, the treatment received. But you do already have a higher chance of having a severe case. I should mention that. You're not going to automatically have a severe case, but you have already an increased chance, which is why you should be very aware of that and get the treatment that you need. So number 3, as a vapor, am I more likely to be infected or to have more severe symptoms than a non-smoking smoker? So I should mention about vaping, a lot of the vapes, which are fairly new on the market, and a lot of younger generations tend to use vapes. It's a non-tobacco product for the most part. They do have nicotine in them, and they do carry some aerosols in them. So that is something to mention. And like I mentioned, vaping is relatively new, so there's not that much research, especially with it correlating to COVID, but there is evidence that the exposure to all the aerosols produced by any type of e-cig or vape, regardless of whether the substance is tobacco or not, or the flavoring or any type of cannabis substance, because vapes can be used for cannabis and marijuana or any type of substance like that, it can still cause harm to your lung cells. A lot of the aerosols and the product itself does do some lung damage. It does have a difficulty breathing already. So you already have some type of respiratory malfunction. So when you do get in contact with COVID, again, you have an increased chance of having a severe case because you already don't have that proper healthy lungs like people who do not smoke. So it does do a lot of damage to your lung cells. It does damage to your tissues, and it increases big inflammation. So it also just affects and diminishes your ability for your lungs to even respond to any type of infection. So that is why if you are someone who is a vapor, you're more likely to be infected. And also the vape itself, like I mentioned before with cigarettes, it could cause virus particles. Like you're more likely to share vapes, and it can carry it in your vape, any type of the virus particle. So that is something to mention as well. So not only may you have a severe case of COVID, you're more likely to contract it that way. Again, like a very similar response to a cigarette. So the last question is, what about smokeless tobacco? So smokeless tobacco, like cigarettes and like the vapes, it still has that hand-to-mouth transmission. You're putting chewing tobacco from your hands into your mouth. Are people really washing their hands before they do this? They're touching the outside of the bag or whatever you have it in, the little tins. You're putting something into your mouth that's foreign, and then you're going on touching something else. So, there still is a really big risk for contracting it. And any type of tobacco product, there's still a lot of underlying medical conditions smokeless tobacco can cause, such as mouth and throat cancers. So there's also that big thing for a risk of having a severe case. And one thing I want to say about the spread of COVID with smokeless tobacco that I forgot to mention previously is that it causes a lot of spit and saliva. That's a big contributor to the spread of COVID, like I mentioned before. Spit, any type of talking or coughing, sneezing, any of those particles coming out of your mouth. So it definitely, smokeless tobacco does cause a lot of spit, so there's more particles that can go into the air. So that is one thing we could say as that does definitely increase the risk of contracting it. So next slide, please, Sean. Okay, so my favorite part is the prevention. So we talked about what COVID is, how it affects your lungs, your heart, and how tobacco use can also be a big contributor in having a severe risk of COVID-19. So one of the things I want to mention is just how to prevent it. The number one, because there is no vaccine or a true cure for it, is to wear a mask. One of the best ways for you and for others is to wear a mask. The best ones are probably the ones with the filter and the disposable ones, because you could easily just throw them out after one use. But the cloth masks can work. There are ones that have other filters, like I mentioned before, which I haven't mentioned before in this one, but that people have mentioned before, I should say, that, definitely do good, like the N95s. There's also one on the market that's rubber masks, but I have heard that it's hard to breathe in those. So make sure you're breathing in them. If you can't necessarily breathe in your mask, try and find a new one that could fit your face, and that you're able to breathe through it. You have to have it, make sure to cover your nose and your mouth. And so they're usually masks are one size fits all. I'm putting up quotations when in reality it's one size fits most. So if you are someone with a big head or a big nose, mouth, or whatever, sometimes a regular mask can't fit you. So you make sure you are having a mask that can fit you properly. I know a lot of people recently, a lot of people were wearing the bandanas, especially in the beginning from March and April when masks weren't easily accessible as they are now. And the CDC did kind of put out a report saying they'd rather you wear other masks besides the bandanas. So that is also something to note. And those neck ones, I'm noticing there's like those neck masks that go from your neck to your nose. They kind of look like those book socks that people used to use for textbooks, or still some people use for textbooks. That's kind of what they look like, that type of material. And I've also, I believe the CDC also reported those don't really work or aren't as effective as the disposable and cloth masks. So, but people still are wearing them. I do know fashion is fashion. So if you are someone who does have a bandana and want to wear it out, just make sure you're wearing a disposable or another mask underneath it, as well as those neck ones too, which is actually adds more of a benefit than it does because you're helping with two masks rather than just one. So that is also something to note as well. So just make sure you're wearing a mask, look into it, make sure it fits your face, like I mentioned before, and try to have some on you whenever you go out. It's very important because you may be helping someone else out, like someone must have forgotten one, or they're just not wearing one in general. So you could be good spirited and have a couple masks in your bag or on you. Number 2, cover your mouth. Use a tissue if you cough or sneeze, then throw it away. Like I mentioned, the mouth and the nose are big. The particles that come out of your mouth and nose do have a big effect into the air, and that's how COVID is transmitted. So just make sure you're covering up. If you don't have a tissue or to cough or sneeze, one of the big ones that they definitely teach you now is to dab into to put your mouth and nose into the crook of your elbow. Dabbing is that new move that people do. So that's why I'm calling it dabbing and not just made it up on the fly. But it is very effective in not spreading whatever is coming out of your nose and mouth. So just to do that as well. But if you do have a tissue, that's better because then you could easily throw it away. Number 3 that I'm going to mention is to please wash your hands. Especially from the beginning of COVID or this pandemic, a lot of people were just consistently buying hand sanitizer and not even hand soap. Hand washing goes a long way. If you are washing your hands for at least 20 seconds in warm water and with soap, going from the tips of your fingers all the way down to your elbows, because you don't know a lot of surface your wrist to your elbow can touch. So it's important to fully wash all the way to your tip of your fingers to down to your elbows. And it, prevents the transmission because you don't know what you can get on yourself. And if you do have it on your hands, you could transmit it somewhere else. So just make sure you're washing your hands as frequently as you can. Obviously, there's not always an access to a sink and soap. So that's where hand sanitizer comes in. If you are going to use hand sanitizer, which I recommend you do, especially if you're going out, try to make it have at least 60% of alcohol. Otherwise, I don't think it'll necessarily work, because if it has more than 60%, it'll be easier to kill off the bacteria. So always try to read the bottle before you buy the hand sanitizer. Make sure it will kill off the bacteria and have more than 60% of alcohol. So next thing. Okay. Like I mentioned before, there are a lot of symptoms that tend to be very similar to other viruses. So it's very, very important that you go to your doctor if your symptoms get worse. And, if you do start to develop symptoms, it may be best to actually get a test to make sure that you do have COVID or you don't have COVID. But when you go, make sure you are being as safe as possible, wearing a mask or gloves or whatever you feel that will make it even more for you to not prevent anything that you have. So if you do have symptoms, like I mentioned, fever, chills, nausea, loss of taste or smell, please go visit your doctor. Please get tested. One of the things we preach, especially for the CATCH program, is that you should really you should be getting tested for anything really. That includes HIV, STIs, and especially now COVID, because you won't know if you have it or not if you don't get tested. It's always important to keep yourself safe and also others. So if you find out that you were tested, you are more likely to put yourself in isolation so you're not preventing the spread of it. So very important to please visit your doctor. And if you do have symptoms or any type, make sure to visit any of your healthcare providers. So next one is social distancing. They said that at least 6 feet is recommended. However, though, particles that come from your mouth or nose can reach further than 6 feet. So you can do up to 10 or even farther away. Just make sure you are keeping a, appropriate distance between people. And also if you do wear a mask, it's better. Like if you have a mask, because not only are you being 6 feet away and wearing a mask, it's a lot harder for the person next to you or the closest person next to you to receive COVID if you have it, and vice versa. So please be sure to social distance, keep 6 feet apart. And disinfect frequently, like I mentioned before about your hands that can hold bacteria from your wrist to your elbows. So can a lot of surfaces, even though they did say you can't get COVID from surfaces, you don't know how long it's been since one person with COVID had touched a cup and without it being disinfected versus someone who did not have COVID. So it's always, obviously that's more based on time. So that's what the package is that people are really nervous about. But if you are someone who does have COVID, you could easily touch your phone or a cup and someone could immediately touch it after, and that could be a big transmission. So that non-COVID person could touch the cup or even, bring their finger to their lip and whatnot, and that's how it can be easily transmitted like that. So make sure you are disinfecting frequently and try to do it at least daily. And common used areas, like I mentioned, door handles, any type of counter, keys too, if multiple people are driving a car, even the sink handles, those get touched quite often. So make sure you are disinfecting frequently used areas and frequently disinfecting. Next slide, please, Sean. Okay, so the recommendations. Like I mentioned before with hand sanitizer, it's very good to or useful to have hand sanitizer on you. But don't try to use drinking alcohol if you're going to make your own hand sanitizer. Now, a lot of more companies, like I mentioned before, face masks, especially in the beginning, weren't as accessible as they are now. And same with hand sanitizer. A lot of companies are even giving them out on the street. So you don't have to necessarily make your own hand sanitizer. It's very easily more acceptable, and now sometimes it's even free. So please do not use drinking alcohol, because that really does nothing, especially with hand sanitizer. It doesn't kill bacteria like we're used to. It has to be some type of distilled alcohol that they do use. And don't take unrecommended medication to treat COVID symptoms. I noticed, especially in the beginning, there's these holistic approaches to combating COVID. And while, they kind of do more to ease your mind and other things, they don't necessarily actually kill the virus. A lot of what I saw was on Facebook and on Twitter. A lot of people were boiling citrus fruits and, putting people's heads over them to clear out their symptom and completely wash out the virus, which is inaccurate. It might help for like just your self-esteem or peace, give yourself a piece at peace, really. Just keep your mind at ease. But it doesn't actually treat COVID, and especially other ones. I know hydrochloroquine, which was pretty much up in the air, and people were talking about how it did help them with COVID. Hydrochloroquine does have It can, I guess, in some cases. However, it is a powerful medication that if someone who has an underlying medical condition, particularly with heart or cardiovascular problems, it is not recommended for them because it does a lot of lasting damage to the heart. So it is really recommended they're not going to go out and use that as a preventative measure for COVID. But remdesivir is probably the most popular one that people have been using to treat COVID, and it is doctor approved and CDC approved. So that is the one you should look into. If you do have COVID, your doctor will prescribe it to you. And just, doctors and healthcare professionals, they have really researched this and, taken their time with how to prevent it and how to treat it. So make sure you are listening to your doctors and medical providers, because they kind of know exactly what's going on more so than a lot of the media outlets do. So just make sure to not take unrecommended medications and to listen to doctors and healthcare professionals. So the do: wash your hands frequently, like I mentioned before, and use hand sanitizer. Dispose of your mask and tissue properly. The disposable ones, make sure you are throwing them out properly in the garbage and not flinging them somewhere else. And if you are using the cloth mask, make sure you are washing them, or either hand wash, or sometimes they can even be washer machine safe. So make sure you are properly disposing that, and disposing of your tissues as well. Make sure they're going in the garbage and not landing around it. And one of the big ones that I really ask is to wear your mask over your mouth and nose. Like I mentioned, nose particles and mouth particles come out, and that spreads the transmission of COVID. So make sure you are covering those both up when you are out or with other people. Like as you can see, I'm not with anyone, so therefore that's why I'm not wearing a mask. But if you are out and about, make sure you have a mask on. Another one I also want to mention is gloves. A lot of people don't, obviously there was a bigger issue in the beginning than it is now, but you could still very much wear gloves out. Just ask that you do change them, because it's kind of like your hands. Your hands do touch a lot, and it can transfer to other surfaces. And just like gloves aren't antibacterial immediately. So you have to dispose them quite frequently. So if you are touching things, you gotta take them off, throw them out properly, and then put a new pair of gloves on. Because again, just like your hands, you touch a lot of surfaces, and you will touch a lot of surfaces, especially with gloves. So just making sure that you're properly disposing of them. The best way to throw out your gloves is you take one hand and put your thumb underneath it. So you slowly unravel it and put it inside out. Then you put it in the middle of your other gloved hand. Do the same thing with your thumb, put it underneath and flip it inside out, and then just throw it out like that properly into a garbage can, not around it. So gloves are good. Just make sure you are frequently putting new ones on if you are going to use them. Next slide, please. Actually, 2 slides. Our videos aren't working. So like I mentioned before, this is just a quick little picture. The effect of coronavirus can be worse for people who use tobacco. So like I mentioned, it doesn't automatically make your case a lot worse. It just can be worse because the effects that tobacco already does on your body, it could make it a lot worse. And again, it just depends on your immune system. It depends on the medication you're receiving and your treatment. There's a lot of things that can go into your severe case or mild case of COVID, but tobacco use does have a negative effect on your COVID case. So that's also something to mention. Next slide, please. So obviously I talked about the ways to prevent COVID. I'm going to talk about the ways to quit smoking. Obviously, this is a personal decision. Only you can really decide whether or not you want to quit smoking or not. Quitting smoking does have very healthy effects on your body. There's never a late time to quit. These are some of the things you can do to avoid quitting smoking. Any type of nicotine replacement therapy, where using types of gums or lozenges, patches that can help give you the nicotine that you need, that you just don't have to get from smoking or any type of tobacco product. any type of avoiding triggers. Any triggers can be, just having a cup of coffee in the morning at the same time, and then you tend to do that with smoking a cigarette. Avoid type of triggers, change up your routine to make sure you're not gonna likely get the habit of smoking again. So any type of delay, if you're just delaying, instead of having 4 cigarettes a day, try and delay it to 3 or 2, or delay the time of when you usually smoke. Get physical, a lot of exercise does a lot more for the body, so it also helps distract your mind from smoking. Any type of practice relaxation techniques, any type of meditation, yoga, these do help with small, simple ways of quitting smoking. And any call for reinforcements, we do have a lot of resources on us. Like I mentioned before, we do a lot of tobacco cessation trainings, and we do have a lot of resources. So if you do want to contact us, all of our information will be linked below, and make sure to check it out. Next slide, please, Sean. So this quote is from Richard Brinsley Sheridan. The surest way to not fail is to determine to succeed. If you believe you can do something, you'll do it. I talk about the law of attraction a lot, and it's whatever you put out into the world, you will receive back to you. So if you are someone who fully believes that you will quit smoking, you will do it. If you do have some type of doubt in your mind, it's going to be a lot harder. And a lot of your mindset really plays a big impact on how you act out on things. So if you believe you're going to quit smoking, you will do it. And I think that's definitely something to have. You have to think positive thoughts, and the universe will reward you with positive thoughts. If you do think negative thoughts, there's going to be some negative energy towards you. So that's always something to remember, not even just to quit smoking. That's just a general rule of life, the law of attraction. Next slide, please. And like I mentioned before, there's a lot of healthy effects on the body if you do quit smoking. You have decreased heart risks, you thin blood, lower cholesterol, you do have clearer skin, and whiter teeth. There's very minimal physical effects of, obviously there are physical effects of smoking that you could see, but when you quit, there's a lot of benefits to that you don't even realize. Like I mentioned, clearing your skin, better vision too when you quit smoking, which is like smaller things that we don't necessarily notice until after we quit. Stopping lung damage. If you are consistently putting tobacco into your lungs, it's going to cause a lot more damage. And like I mentioned before, lung damage is a very big part with COVID and tobacco. So if you do decide to quit, it's going to stop lung damage from, all the effects that could happen further, just to stop the lung damage, which is really great to understand that there's a lot more effects of just quitting smoking. It's not something that like, oh, I've already done it, the effects are going to last for the rest of my life, which isn't true. If you do stop, you're not further putting more tobacco, any of those ingredients into your body. So it does do a lot more, it does more to your body in a good way than it doesn't if you quit smoking. And like I said, there's no wrong time to quit. One big thing is it lowers your cancer risk for any type of cancer. Tobacco is one of the #1 contributors to cancer. So if you do quit smoking, it does lower your cancer risk. And since I mentioned before, smoking and any type of tobacco product does lower your immune system, weakens it. If you do stop, it will strengthen your immune system. So these are small things that we don't realize. We're like, oh, even if I quit now, what's done is done. That's not necessarily true. I think that's, like I mentioned, it's a negative effect of what you say to yourself. There's always a time and place to quit, and there's always a time and place to improve your body. As you get older, you could still strengthen your immune system. It doesn't, it doesn't just stay the way it is. Our bodies are increasingly changing every single day, our body functions. So that is something to note. What's done is done is necessarily not our bodies. There's much more technology out there, and simple ways to quit smoking. Just like if you want to lose weight, what's done is done isn't necessarily true. You could still lose weight and still gain weight frequently in your life. And that's kind of similar to smoking and non-smoking. So that is something to note as well. So next slide, please. And what I've preached in the last 5 minutes to you, it is never too late to quit. And I think, a lot of people still are in the mindset that it is too late, but it is never too late to quit. It could do a lot more damage if you do consistently smoke compared to if you do quit. So that is always important to know. Next slide, please. So like I mentioned before, we do a lot of tobacco cessation webinars. We do have a lot of resources. And these are just a few of them. If you would like them, we'll put them linked in the bio below. Just a few things that you could look into for tobacco cessation. Next slide, please. Okay, so how can we help? So like I mentioned before, we're part of the CATCH program, Community Action to Combat HIV Hepatitis C. We are located in New York City. One of our jobs, like I mentioned before, I'm a health educator. So what I do is I educate others on types of sexual health, mental health, and tobacco cessation in group sessions or confidential sessions, as well as test. One of our very important parts in our program is Christopher Olin. He's our behavioral health coordinator. And these are just some of the things that he could do. He does a lot. He has a lot of resources and can provide you a lot of knowledge and get you what you need. So his particular role is pre and post test counseling for HIV and hepatitis C. He does a GIBRA, which is the Government Performance and Results Act. He connects clients to medical services for HIV and hepatitis C. He connects clients to substance use services, including smoking cessation, but that includes a lot of other substance recovery programs. He also connects clients to mental health services. He connects clients to local food pantries, and helps to improve food securities. If you are someone who needs that in particular, Mr. Olin will have a resource and connect you to your needs as soon as possible. And he assists uninsured individuals to get access to medical insurance. So this is some of the things that our behavioral health coordinator does. Next slide, please. And I also just wanted to mention my staff. Like I mentioned before, my name is Olivia Duffy. I'm a health educator. My coworker, who I've been facilitating these webinars with, Yamina Castillo, she's also a health educator. Usually these webinars, our tobacco cessation ones, are held at 2 p.m. on Tuesdays and 6 p.m. on Tuesdays. Usually I do the 2 p.m. one and she does the 6 p.m. one. It is usually the same topic, but usually we just split them up into two in case anyone, can only attend one and not the other. So that is what we do. Like I mentioned before, Christopher Olin, he is our behavioral health coordinator. Like I mentioned, all his resources and what he does in case you need something from him. He's a very important person to know. And I just want to thank my technical coordinator, Sean Belgrave, who has been with me doing these webinars and helping make sure there is no technical issues. So thank you, Sean. Next slide, Sean, please. And these are some of our resources about quitting smoking. Next slide, please. And thank you. If you have any questions for us, we are at arguscatch@gmail.com, 929-322-4106, and you could find us at arguscommunity.org. We do have a Facebook, we do have an Instagram, and we do have a Twitter. They will be linked also in the bio if you want to follow us, or direct message us for any questions. If you want to test for HIV, if you want some tobacco cessation resources, we are here for you. So thank you so much. Next slide, please. And like I mentioned, we do the webinar every Tuesday and every at 6 p.m. and we do one at 2 p.m. So try and join us next week if you missed us. But we'll probably be posting these and recording these on our YouTube and such. Also, some of our lovely members of our team. They do a sexual health webinar every Wednesday at 2 p.m. And it ranges from topics of sexual health and COVID to HPV and all these types of sexual health topics that are very important to the public that everyone should attend as well. So I'm promoting that as well. So I just want to thank you guys so much. It was lovely to do this webinar with you guys to learn, and if you guys have any questions, please contact us. Thank you so much, and I'll see you next week. Bye.